Hi, I'm Bruce Thomas. I'm with MEMA Orthopedics and Sports Medicine, and I'm the spring training physician for the Washington Nationals. I was going to take a few minutes to tell you about what a typical day in the life of the spring training doctor is and what we do. Usually start out a day at the hospital over at Holmes and would see a couple of patients at the Regional Medical Center, followed by some office hours, probably till 10 or 10:30. At that point, I make my way over here to Space Coast Stadium, beautiful day like today, and find the training room where usually there's a couple guys already waiting. Most of the games are around 1 o'clock during spring training, so I'll show up around 10:30, 11 o'clock and see any of the players that have complaints that morning. They'll usually report in much earlier to the trainer. Trainer will have a little list for me. It's a lot of fun for me. Over the years, there's a lot of overlap where the guys are with the same team or change teams and come back. So the part I like is the relationships I get with the ball players, their families, the staff, and the small world that is baseball. Any injuries that need tests, we coordinate it usually through our office, such as MRIs or blood tests, that sort of thing. We also perform physicals on every player and most of the on-field staff before the season even starts. They go through our office in a large group, and we have an army of physicians and nurses and technicians that work on them, and we amass quite a bit of data within a few days and make sure they're ready to play. Some of the data is routine, such as you'd get with a normal physical, and some of it is more performance-based, where their strengths and weaknesses are. And we're able to do a team assessment of what they need as far as rehab, prehab, what have you. During the season, when an injury occurs, a physician is required to be on site, and that's usually me. If they are injured and need an x-ray, we have that very close. We have other equipment pretty much within 5 minutes that we can do diagnostics. We're in constant touch with the training staff. We also communicate with the front office, the general manager and his assistants. So there are many layers to it. First blush, it would look pretty simple, but actually it's a skill that you get a little better at every year, and this is my 20th season, and I'm thrilled to be here. I love every minute of it. Wouldn't change anything about it. So that's my story, and I hope you love what you do as much as I do.